In the event of an alarm sounding, please leave the building by the nearest exit and gather at the front of the building. And please note this meeting is being live streamed and recorded. All remote participants are muted at the outset of the meeting and are only able to speak by the invitation of the chair. Please raise your virtual hand for those online if you wish to speak, and then only unmute when a chair invites you to make your contribution. As a chair, I may ask that you are muted if you do not participate in this way. Can I ask you all then to ensure your laptops and mobile phones are on silent? Thank you. And before speaking, if each member and officer could actually introduce themselves so we know who's speaking. So I'll start now by introducing ourselves. I'm Councillor Andy Davies. We could go around the table introducing ourselves.
Good evening, committee. My name is Tanya Miles. I'm the Interim Chief Executive and Director for Adult Social Care.
Good evening, everyone. I'm David Shaw. I'm Director of Children's Services.
Good evening, everyone. Natasha Moody, Families First Partnership Strategic Lead.
Good evening, Sonia Miller, Service Director for Children and Families.
Good evening, Jo Kelly, Head of Virtual School and Access to Education.
Good evening, I'm John Rowe, Head of Education Quality and Safeguarding.
Good evening, Michelle Williams, Service Manager for Adult Social Care.
Good evening, Andy Hall, Portfolio Holder for Education and Children's.
And good evening, Ruth Houghton, Portfolio Holder for Children and Adult Social Care.
Councillor Julian Dean substituting tonight, member for Port Hill.
I'm Councillor Jamie Daniels for Abbey Wood.
Councillor Susan Coleman, Severn Valley.
Mark Morris from the Strettons. Sorry about the voice.
Good evening, my name's Thomas and I'm the Councillor for Sheffield North.
Good evening, Mandy Duncan, Councillor for Sunderland and Old Heath.
Shelley Davies, Committee Officer.
Good evening, I'm Sophie Foster, Overview and Scrutiny Officer.
Thank you all, and lovely to see you all this evening. We'll start with apologies for absence. I've got Councillor Terry Trickett, Councillor Duncan Kerr, Councillor Julian Dean, thank you for substituting this evening, and Gemma Martin, and Alan Mosley. Are there any other apologies this evening? Okay, thank you. Move on to disclosable pecuniary interests. Do we have any? No? Okay. Excellent. Thank you. Move on to item number 3. Minutes of the meeting held on 22nd of October. Hope you've had a chance to read these. And do we take as a true reflection of the meeting? Is someone willing to propose them, please? Thank you very much. And a seconder. Thank you very much. We'll now move on to public question time. And we've received a question from Mr. John Palmer on the Children's Services Reform. If you'd like to take your seat, Mr. Palmer.
Thank you very much, Chair. This is really the Children's Services Reforms Report on your agenda. Paragraph 1.2 in the report quotes, "These reforms signal the largest changes within children's services in decades," unquote. The intention for these reforms was announced February 2023, but it's taken 3 years for these detailed plans to come before this council. It's a tribute to the determination, ambitions, energy and focused intent of the Labour government that this is now moving nationally and locally. In stark contrast to their chaotic stasis of the anti-real people Tories and the cluelessness of the policy-devoid tumbleweed of the far right. As an observer, I am justifiably pointing this out because I know Scrutiny Committee members are collectively stymied from coming at this in such straight talking based on recent utterances. Does the Scrutiny Committee Chair agree that the report is full of impenetrable insider jargon? Won't families seeking help or being identified as needing help appreciate much more clarity, clear language, tangibles about who, what, where, how soon, how often, how is the queue formed, who leads on communications, who decides, etc. Because of this jargon, is the committee chair worried that achieving recommendation 3.3 in the report, which is seek to understand the reforms well enough so that you can champion and advocate ... the changes that will be needed across the council, will be challenging? Would the committee chair like to hear if, out of professional curiosity and an instilled culture of renewing collaboration, shared work responsibilities, interaction, advice seeking and reporting, that staff not primarily employed as children's services qualified experts are already getting in touch to ask for shares, summaries and planned communications of these fresh goals?
Thank you very much for your question. These reforms are the largest in decades and were indeed announced in February 2023, a while ago, after the review of stable homes built on love. However, the rollout has been undertaken in stages with pathfinders in different local authorities, testing and learning what works before the full rollout across the country. The reports relay on a set of national reforms ahead of seeking cabinet support to implement them locally. If there's any specific jargon which is unclear, please let me know in writing, and I will ensure that a glossary is appended to the document to develop that clarity for you. As a way moving forward, I think the council can learn from this, is to ensure that in all reports, should, for example, an acronym be used, the terminology is used prior to using an acronym, so it's very much clear to people reading it on the clarity and the meaning of it. Staff working across children's services undertake a range of roles and have been part of developing the planned actions set out in the action plan. There is a plan underway to ensure that all staff working within the local authority are aware of the reforms and can start to build the actions into their service and their team plans. Does that answer your question? Thank you.
Am I allowed to follow up?
Yes.
And would the committee chair like to have seen even more professionals attending this meeting, excited by these incredibly positive actions being introduced?
I am very excited already with the number of professionals we have in the room. So the excitement might be even too much for me, to be honest with you. But it is lovely to see different portfolio holders have actually attended. We've got quite a lot of officers who have actually fed into the reports as well. So I'm very appreciative of the people who've actually turned up here as well. And the amount of work which has actually gone into the production of this report, I'll say from the outset, is fabulous. You're implementing on this a national initiative, and in Shropshire, with our sort of constraints we have, I think we're trying to do the best we possibly can for it. So I think we're very lucky to have the officers we have present with the skill and knowledge they have around them. Thank you very much indeed for your question, Mr. Holman. Okay, member question time. We've received no questions from any members. I'd like to move to agenda items around just a little now, please. Could we start with the Children's Services Reform? For a difficult moment, and then we'll move on to the quarterly performance report once we've completed this.
Thank you very much, Chair. So, colleagues, it's wonderful to have you here this evening to outline the discussions around the Children's Services Reform. And as you've heard already, the reforms are genuinely the most wide-ranging across a number of services we've had for many, many years, in some instances since the inauguration of initial acts in this space. So they are really, really quite fundamental. I'm going to introduce Natasha in a second to step through the overview of the wide range of programmes, but I think it's really important that you hear from me as the Director of Children's Services that fundamentally this is about one council working together as one children's services team to deliver the best outcomes we possibly can for children and young people and their families in Shropshire. And within these reforms, we don't just talk about the children's outcomes. Actually, what we have to always remember that those young people have various different groups, family members, and wide-ranging networks that support them or equally bring them challenge in their lives. And part of the work that we need to do together is to unpick and unpack that so actually we can enable children and young people to be as safe as they absolutely need to be to remain fundamentally within those family environments. And that's a fundamental principle I want you all to hold in your minds as we work our way through the next few slides this evening. So I'm going to hand over to Natasha, and we look forward to stepping you through this fundamental reform programme. Thank you.
Thank you, David. So I'm just going to talk about the programmes that we're talking about briefly before we go into some detail about what we've done so far to date, so that you've got sight really of the programmes of reform. So there are fundamentally 5 different programmes that have been initiated either by the Department for Education or the Department for Culture, Media and Sport. And all of those programmes fundamentally seek to rebalance the system towards greater early intervention and prevention. And I think that's on growing recognition that actually the amount of money we're spending now is probably similar to we were in 2010, but actually the outcomes for our children are probably poorer than they were, with far more children in care today than there were in 2010. And so across all of these different programmes, there are different things that we're required to deliver, which I've included in the report and in the presentation slides. And I just want to talk you through those so that actually you understand the detail of this programme and just how significant it really is. So essentially, in terms of Families First Partnership, this is a programme to try and seek to rebalance the children's social care system. And it's really talking about initiating, really, I think, 4 key changes across that system. So some families who come to the local authority or its partners might need some additional help. They might be struggling with a number of different things, whether it's financial support, relationships within the family household, caring for children with disabilities. It could be a range of different things. And at that point, when they first become known to us, we would traditionally call that early help. And actually, for a long time, there's been a kind of big transformation really around early help. And I know in Shropshire you've had an early help strategy to help deliver that. And really what it's saying is we want to see more of that work happening across that partnership in a broader space. So actually it's asking us to think about those children who would normally be classed as children in need and make that one system of support. And they've branded that as family help. They're asking us to work as multidisciplinary teams in a partnership. Now, traditionally, a lot of the onus would have been on the local authority to deliver a lot of these changes, and actually you can see a fundamental shift coming from central government around the fact that actually this is no longer the local authority's responsibility. This is partners working together to safeguard and protect those children. And so it's asking us to work as multidisciplinary teams, whether that's in strategic forums or actually in practice with our children and families, to make sure that actually across police, local authorities, health, education and childcare settings, we're able to make sure that all of our support is pointed at helping those children to meet their needs as early as possible. And again, I think that is in growing recognition of the vital role that some of those early help services and some of those kind of mechanism support are incredibly impactful when they work. So yeah, it's asking us to do that more in a multidisciplinary team way. And I think that's fundamentally asking us to move towards co-locating in local communities. Now I think that's going to be a challenge for Shropshire because of the rural nature of the area. But actually, I think it is something we need to think about. What do those local communities and what do those local needs look like, and how do we establish ourselves within those communities so that people know where to go to get that help and support? And it talks very much about using the family hubs as local bases to do that from. So I know you've got community and family hubs already in existence here in Shropshire. So how can we utilise those community spaces really to help us build up and out from? As David talked about, children are part of usually wider family or community networks. Often those families might struggle to meet their needs and sometimes need to rely on community members to support them. you know, whether it's through formal charities or networks of support that they might have with friends. And actually the government are asking us to do much more work in that space, so that actually we don't talk about those family networks just before children come into care, but we talk about them right from the beginning of having those early conversations. So I don't know about anybody else, but my mum had a friend, Sylvie. She was always known as my auntie, and that's because she was part of my community network of support really when I was younger growing up. So that's what it's trying to instill, actually. How do we make sure that we galvanise that community and those families and that broader network? And then the final aspect of change is around multi-agency child protection teams. So this is completely new. The Pathfinders who started to initiate some of these changes 2 years ago are still grappling with this. We've had some guidance as recent as this week talking to us about what that needs to look like. But it's really clear that they're asking for a multi-agency child protection team that can consist of police, local authority, health partners, education. In the guidance, it talks about other partners like probation, youth offending, that might make up that team. And essentially it's not necessarily to be the people who are providing the care and support for that family, but it's providing a second look into the case to say, actually, have we exhausted all of the options that we might have available to us to make sure that actually those children don't come into care, because we know that when they do, unfortunately, the outcomes are often not better. So those are the kind of 4 aspects of change in terms of Families First Partnership. In terms of family hubs, so the government are really keen that we use Best Start in Life family hubs. I think it's really long, but actually it is something we've got to talk about more. So we've been asked to identify basically a Best Start in Life family hub site, and we've got to identify one of those by the end of March. And from that site, we need to be able to deliver a range of parenting interventions and home learning support. So parenting programmes, I'm sure, are something a lot of you will have heard about. Home learning interventions are actually getting on the floor with a child in the family home and trying to help to model some of that practice. So essentially, we've been asked to do that to support the government's overall ambition of making sure that more children get to school ready to learn. There's a number of different aspects that make up a family hub which are much broader than that, but that's the ask of central government at this time. Just before Christmas, I don't know if anyone will have seen it, there was a publication of the youth strategy. This was a new national strategy, first one in over 10 years. It's called Youth Matters. That builds upon, I think, something Helena came to speak to this committee about in terms of local youth transformation programme last time. And it basically talks about making sure that there is a commitment from central government for local authorities and partners to work to make sure that there are those key areas of support. So trusted adults, strengthened workforce, friendship and relationship, access to meaningful activities, good work, keeping young people safe, ensuring people are involved in decision making, and making sure that young people have got access to support when they are physically or emotionally unwell. So that's a big, bold ambition. It's a 10-year strategy, so I'm sure we're not going to accomplish it all tomorrow. But again, it talks really clearly to that early intervention prevention space, because we know that this is an area where we nationally have seen an increasing number of children coming into the system in that age bracket, but also we know that their needs can be different than other children, and actually we need to make sure that they've got access to the support they need to make sure that they're able to thrive. So again, that's another key aspect that we're looking at. Another one is a Pathfinder programme that we're involved in around private law proceedings, which is talking about making sure that we triage those children who come into the court arena, so that actually we can make sure that they get access to timely decisions from the court, so that actually they're able to make sure that they're not kind of unnecessarily going through additional trauma really from reliving some of their past experiences. And the last one relates to sending alternative provision. Now, this one for me is the most meatiest, but probably the one we know least about. We would do a white paper, I think, in autumn last year. It's been pushed to New Year. Still no news of it yet. But what we do know is that actually this DFE have written to local authorities already to ask us to work in partnership as a local system to make sure that people have got access to early, local, fair, effective and shared systems, so that actually we're again starting to rebalance that system towards really making sure that we've got inclusive provision and communities around them. So all of those things, whilst they might have particular focuses because of the demographic, either because of, you know, the age of the child or the cohort of children that we're talking about, are all really talking about actually how do we make sure that we've got an effective and collective early help and effective early intervention and prevention for our children. And that's something that we're really keen to develop here in Shropshire, because we know that over the last couple of years, actually, the investment in that arena has declined. So these reforms are really welcome to us. And as David said in the beginning, we're looking to make sure that we bring all of those together because there is so much synergy across them all. So this is just a table that tries to illustrate really where we've got combined or collective effort that's being driven really from central government and how that might help us to support to bring that together under one change programme. So what we're doing is, instead of leading these programmes independently and separately, is we're trying to make sure that all of that children's change is built under one transformation programme, so that we've got one plan that helps to guide us all really and helps us to work effectively as a children's services team to make sure that we meet those objectives of all of those national programmes. And I say that like it might be relatively easy, but for those of you that have looked at the action plan, there is a lot of things that we need to tick off, but actually doing it together we're more likely to be impactful, I think. So in terms of progress made to date, just to keep you cited really on that, so we've appointed key personnel to support us in the local authority. So my post is new, been brought in to help deliver some of this change. We've also appointed somebody from the police, Natalie Arrowsmith, who's been brought on to help us. Health are just in the process of doing the same, so that we've got key personnel from each of those organisations to help us to land this within their respective organisations. We've aligned the change programme with the wider local authority improvement plan, and we think that's important because actually not only do the themes align really well to the national agenda, but actually it helps us to support the corporate response really. We've been doing a lot of work to try and raise the profile of the reforms. You know, I think we've made good progress, but I still think there's more to do in terms of people's understanding of what it might mean. We've been out to do some multi-agency sessions before Christmas. I think it was the end of October, where we had a session to look at what's working well in the system, what do we need to get better at, and we've done something similar with education and early years settings just last week actually, John, didn't we? So there's a lot of work going on really to make sure that people are sighted on what this might look like. I think the focus for the new year needs to switch now to parents and families. Now that we've got some understanding of what professionals think, I think we need to try and understand and triangulate that with what children and families themselves think. So that's the focus for us for the time being. We've started to work with all of those stakeholders we've been working with around developing our vision. Again, I think that's a work in progress, and I will share where we've got to with you, but I think it's really important that we do hear the voice of children and families, and I suppose to the point earlier about, you know, this feeling like jargon, one of the things that has come out from some of those sessions is that actually sometimes the language divides us, and we need to find a way of trying to unite not only children and families, but all of those different system partners who all have their own language that kind of sits around the work that they do. We started to draw out the governance structure, which again we've included in the report today. We've drafted the delivery plan, which is here for you all to see. I would really welcome people's comments and observations about that plan. What we've essentially done is taken all of the guidance we've been given and tried to consolidate it into one plan, but I am very conscious that you as local members will have a view on your local communities, local needs, what this might need to look like to be effective in this local patch. We've identified the task and finish group structure, and we've done a self-assessment to understand how far we've got to travel in terms of implementing the reforms. I think so far it feels like we've had relatively good engagement from most partners, and I was really pleased to see over 40 schools, I think, last week on call, just trying to help us define and deliver this programme of support. That felt really positive to me from an education perspective, but I still think there's more to do in terms of making sure that we do get that voice of the families themselves. So in terms of self-assessment then, I just wanted to give you an idea of where we are, because this might be something that actually as a committee you want to look at more as we move forward. So the idea is that the DfE have asked us to assess how far we are from delivering the reform. So red is we're nowhere near, the green is we've got some green shoots or nearly there, the amber is we're somewhere in between, and what that I think shows you is that actually when it comes to some of those reforms we have got a way to travel. So the one that's in blue, the column in blue, is the one that is about family group decision making, so engaging families in those decisions that are made about them. So actually that's the one we've probably made the most progress on. Which I think is a credit really to all the work that Children's Services and the partners have been doing. Interestingly, partners don't really understand that as well as we do, so I think there's some work to do to help them get there. And as you can see, the middle column in orange is the multi-agency child protection teams, and that's the one where we've probably got the furthest distance to travel because it's a completely new concept. Interestingly, the column in the darkest blue, that's about family help and how effective we are at delivering that. And I think what's really interesting about this is we completed it as a multi-agency partnership, and I think if you were to look at the local authority self-assessment next to the partners, it would look very different. So from a local authority perspective, there's much more green, but actually in that partnership space there isn't enough of that family help being delivered by other people. So actually that's a kind of average position, but actually the local authorities would look very different. So hopefully that helps to kind of give you an overview of where we are. These are some of the themes that we've drawn out from some of the sessions we've had. I'm not going to pull all of them out, but I think the couple of things that I've mentioned already is that the language is really important. There's a feeling that actually children's needs are becoming more complex. I'm going to provide some challenge back and say I think it's actually the system that's becoming more complex and more difficult for children to get the help and support that they need at times. And I think the practitioners recognise that. They felt like the process and the systems were sometimes getting in the way of effective early help and prevention. So I think there is more for us to do, and I'm hoping that actually some of the work we're doing in terms of that corporate improvement plan will help the local authority, but actually shifting that partnership as well to make sure that we're all doing that. And I think there was definitely a feeling that people wanted more face-to-face time with each other in co-located teams actually, and physically being present, not just on Teams. I think there was a real sense that actually if we offered some kind of anchor day where all the people had to be in the office, that would be welcomed by people because they feel like they've lost that touch and connection with people. So there was definitely something coming out around that. From an education point of view, the kind of view was quite similar really, except I think there was probably more focus on what they could see from a parent's perspective in terms of what was getting in the way. So it was definitely a strong sense coming through from early years settings around they feel like the mobile phone has become a real blocker to that parent and child attachment and that kind of parent-child relationship. And there was a real ask really of early years settings for us to talk to parents about how do we kind of engage them in a conversation about this without becoming preachy. So I think that's something we need to reflect back to parents. And there was also a lot of kind of feedback really around them recognising the role that they play. So for example, we had most schools I think saying we absolutely think we should be the family help lead practitioner. We absolutely think we should get support from that wider network of support in terms of that multidisciplinary team. But actually what it might look like in each of those education settings might look really different. So we heard from an early years setting, for example, who talked about the fact that they got some really good support from a school that was on the same site. We heard from a really small rural school that had only got 10 or so pupils that was saying, actually, for me, I can't afford one of those people that you and your multi-academy chain can. So there's a lot of work happening at the moment in terms of that threshold document to make sure that schools are actively engaged in that, because I think in that document, we need to make sure that we're really clear about what the education offer will look like. So we need to stipulate that we do think schools will be family help lead practitioners, but we also need to talk about how that might differ across those different settings. And this was their version of a working draft of a vision. So this is not by any means finished, but I hope it gives you some sense of where we're travelling to really. So we want to see a child that thrives in a safe, supported home where families feel empowered, communities and services work seamlessly together to improve their lives. So we kind of consolidated all their feedback from that session. I didn't think we'd get to that point, but actually they came up with a good, I think, working draft of a vision. What I think we now need to do is make sure that we've got the time to engage children and families in that vision, because I think it's really important that they're part of helping us to co-create this. So I think it's a good idea for you to see where we're headed, but hopefully this will change and reiterate as we get their kind of views and feedback into it. And so, yeah, that's a summary of where we've got to in terms of that. I've included in the pack some information on the governance structure. I won't go into any great detail on that, but what I've also included is the different themes that align to that corporate improvement plan. And I've given you some indication of where we'll see some of those key milestones being. And again, my ask of you as Scrutiny really is that you hold us accountable for the delivery on some of that, because actually it's really important for families that we get this right. And what I would say is it's not just the local authority you need to hold accountable. This is a safeguarding partnership. So it's about holding, both police, health, education and local authority all in this space together, because actually it's really important that we start to demonstrate that we're moving away from local authority and towards that partnership. Just to give you an idea of scale, of all of the things we've been asked to do, about 85% of them sit in that partnership arena and not in the local authorities arena. So I would hope that next time we come, you're calling me alongside my peers within those organisations to provide some of this assurance back to yourselves. I think the final thing I'd leave you with is a bit of an ask really of you. I don't think it would be fair for me to kind of take all of your questions and leave you with nothing. So I'm asking you to hold us accountable for the delivery. I think this programme of work is really important. I think it's going to be quite challenging in the circumstances we've got to achieve it all on time and in the way we'd like to. But I'm committed to coming back here and want you to make sure that actually you hold us accountable for that delivery. I want you to make sure that any future reports that are coming in front of you reflect these reforms in them. And if they don't, I want you to ask questions about the reforms and how the work that they're doing aligns to this, because I think David, Sonia and I are really clear that actually this is one change programme, and if it's not about this, it really, this is really fundamental, and it quite frankly, it shouldn't be being done, because it's going to result in changes to statutory guidance that impact on all parts of the services that we deliver. And then the other thing is we've set up an impact board, I think it was last summer actually, which is really a forum to try and gather the views of a range of different people who've got a stake really in understanding the views of children, young people and their families. So it includes organisations, it includes people who've got lived experience themselves. And we use that as a way to try and understand what are children, young people and families saying and thinking about the services and support that's provided. And so my ask of you as well as local members is that if you get any feedback, you hear anything, you talk to people about anything related to children and families, you let us know what that looks like so that we can feed it into that impact board and make sure we're hearing that voice in real time so that it affects and changes the plans that we're building really. So that's it from me. I shall take any questions.
That's great. Thank you very much indeed. You mentioned about sort of finding out the needs of families. Where in Shropshire we got our urban, we got our rural sort of families as well. What sort of strategies are you using to identify those needs?
Yeah, so there's a range of documents that you've already got in place. So you've got things like your joint strategic needs assessment. You've got things like performance data that we already use. So I'm not planning on reinventing the wheel. So we will use all of that data. One thing the Department for Education have asked us to do is something called a needs and harms analysis. So essentially what that's doing is trying to understand the family composition in each of your local areas. What's really interesting is we've got a first draft of that. There's still work to do on it, but actually in each of the 5 areas where we've got community and family hubs, the needs are really different. So I would imagine during the course of designing some of this work, the composition of those teams should look really different to reflect the local needs of those communities. So that piece of work looks at a range of different indicators that we've got from across police, local authority and health. Things like access to employment benefits, it includes things like access to our services and support. So it really is quite broad. But again, that's one of the things we could bring back to Scrutiny to help you understand more.
And Fanny, with the meeting you've had with the schools, are you using the schools then to seek the family views? Now there's, as I said, 42 schools spread out through the whole of Shropshire. Are they feeding back into your plan as well? Your vision for it? Yeah,
so we've got a number of different task and finish groups that are meeting around the areas that we've got to deliver. One of those is called Family Help, and that is being led by a school leader, a chief executive of school academy chain, and actually she's already enlisted the support of a number of different head teachers to participate not only in that task and finish group but a range of others. We've held there's regular communications that happen with school through DSL briefings, head teacher forums, all kinds of stuff, and then we've put on specialist things as well to try and seek their views. So we have kind of used, I think, whatever mechanism we've got within our gift really, John and Joe, to try and seek those views. So yeah, we absolutely are. And the thing I'm really interested in exploring with those schools is less about how we set up formal mechanisms for communication, but use them to get those constant feedback loops around what's working. So I think there is a real space for schools there, because actually they see, children most days, don't they? So actually can be providing some of that really rich insight that we need. We've just got to try and figure out how we're going to actually work that.
Any question, please, anyone?
First of all, I'd like to start by saying how superb I think the reports are. I think we said this at a previous meeting when we had them. I mean, they're very long and they're very detailed and very specialist, and you have to concentrate when you're reading them, but they make sense. I know there are acronyms in them, but that's unavoidable. They make sense. They they put the points clearly, they give targets, and whether you're just saying you're on target isn't good enough. I sit in a scrutiny facility in another body, and what does that mean on target? We need to know exactly, and those figures are in there, and I feel that it's really useful report that's relatable to us. It's not in language that we can't understand, and we're the people who are scrutinising it after all. The other thing I'd like to mention is that you keep talking about partners such and such, the police. What about the fire people? Because I'm on the fire authority, and they've recently started doing some modules around fire prevention for homeschooled children. It hadn't occurred to me until they said that, but of course, they're not getting anything that happens in the mainstream schools. So they also have a safe and well visit service, and they will interact with the community in different ways as well. And they're probably less in the police. When police enter the community, people have an idea of what it's going to be about. When the fire people come in, I think their reception is slightly different. And I think there's probably a lot that you can learn, and that you can use them to share things. They have very, very good social media, and they share a lot of things on social media, which the public wouldn't normally think was anything to do with the fire service, like flooding, for example, and things to do with road behaviour, which you think was all about police, but it's not, because when you have a crash, it's the fire service that have to cut you out. So I think it'd be important to include them as well, really. And the other thing I just wanted to ask, it's about on the youth strategy, it talks about preparing youths for work. And I did work at Telford Council actually some years ago, and we had a really big problem over there then about the 16 to 24s not being in work. And although their children are now in education till 18 or some sort of education, getting to work, getting a job is one thing, getting to the job is another thing. If they can't drive, which at 18 they might be able to drive, but they can't afford a car, and public transport in this part of Shropshire is poor. So, there are other aspects to this than just having the right skills to get the job. They physically got to be able to get there, and we had a programme which was very, very effective, and the children who were sort of disengaged a bit, and we had some champions, volunteer champions, who came forward, and they literally used to take these young people to the shops, buy them a suit, because they got grant money in the fund, buy them a suit so they looked tidy when they went for the interview. So sometimes it's the basics like that get forgotten about, really. You think you've done everything, but then at the end of the day you've missed something there. So I would just ask you to give us, perhaps elaborate a bit more on that, or look into that a little bit more, to see that we're following it through, really, so that we are getting the best result.
Thank you, that's helpful. So the first thing I'd say is, I think you're absolutely right about fire. The partners are named in statute. There are absolutely lots of other partners who need to be part of this that will make it a success. And actually, I think it's such a shame, really, that we don't talk about other partners like the voluntary sector who are critical in helping us to achieve some of this. So we absolutely will draw on the fire support, and I appreciate that kind of point, really, because we haven't actively engaged them actually as part of the conversation to date, so we will. In terms of young people then, so I think that's what I was trying to say about a lot of the reforms are really talking about how do we get back down to understanding our local communities, the local needs, and how do we make sure that we build that community capacity so that actually before there even is any need to come anywhere near a partner, really, that community is equipped to be able to help and support where possible. And I think what we need to do is use some of that work as part of the needs and harms analysis, which does include the data around young people who can't access work, to really try and help to build that localised plan so that we can understand what the strengths are of that community and actually where there might be that resilience and resource to be able to help with some of that stuff. So I think that's the next step, really, in terms of some of this planning, is to make sure that we are talking to those.
Send me an email or something, because I've got to give it out of hospital.
Is so that we can speak to some of those communities and make sure that they're part of developing that plan, because I think that example is a perfect illustration of actually where the local authority or its statutory partners might not necessarily be able to do some of that stuff, but actually there are lots of people who live in those communities who want to help. So yeah, that absolutely is part of the plan. And as part of the work, actually young people's employment comes up in some patches and not others. So I think again, the nuances of that plan will reflect the local community and its needs.
Chair, if I could just build on that, I think the other point that you made really, really well was around transport and that infrastructure connectivity piece. And I think that talks really, really well to this can't just be a children's services challenge to solve, because we won't be able to solve it. We need to be really frank and clear about that. This has to be a corporate responsibility, not just the council, but strategically across the area. So I think one of the challenges perhaps for committee to consider is how do we engage corporately the council as a whole into this space. So when we're looking at any type of planning application, any type of infrastructure development, consideration of whatever it may well be, this is front and centre for the communities, because what we find, and this is acute in the social care space, and Sonia's team particularly will find when we move a child into care, before we can ideally turn that child back into the care of their family, their biological family, we often have to remove barriers and challenges within that family's life. How do we collectively bring the emphasis and energy of the council as a whole to remove those challenges? So whether that's drug and alcohol challenges, whether that's financial challenges, transport challenges, isolation, whatever it may well be, we can't do that. And I think for a future agenda item, we're talking about some of the barriers around the children in care, numbers in Shropshire, and why we're quite different to other areas. And I think we can have that type of conversation in that meeting, because they are some of the reasons why we've got some of those barriers that we've got. But we're going to have to find solutions to that in terms of unpicking that, because otherwise we're not going to be able to do the work we want to do and safely return those young people to their biological families where it's absolutely appropriate. So it's a really, really good point.
Could I just add to that then? Because in Severn Valley, where I am, it's very rural. I've got one petrol station and 2 pubs. So a day out requires not drinking too much and taking a sandwich. In the 2 biggest settlements, they're Cross Houses and Cressidge, we've got 2 planning applications in for large numbers of houses in Cressidge in particular, and people are saying, well, where are they going to work? They've got to be able to drive to get to a job, and a lot of jobs will be in Telford, but how are they going to get there? So I think including planning is really important. I don't know what the governments haven't been in detail about the government's changes to all the planning laws, and I know there's going to be a lot, so I don't know whether there's anything in there on that, but maybe we can get ahead of the game and start making sure that we include those sort of things when we're looking at these kind of developments, because it's no good just plonking everybody in the countryside expecting them to use a car, because it's just not practical or financially viable sometimes.
Absolutely, and I think that talks to the challenge that we've got as a council, because we're not well resourced central government grant wise to deliver this. So if you look at those Pathfinder areas, they have multiple millions of pounds as instant investment to deliver this work. The grant for this year is £666,000. For next year, it's the same, but we've bundled a range of other grants together into that to increase the value. So I think the other challenge we've got as a council is how do we make this work? And we will circulate to committee, if it's with your permission, Chair, a benchmarking report that was completed by the Local Government Association that sets out the overall spend within children's services as a proportion of the council spend, and just puts that in context with all areas nationally. What we spend on children looked after and what we spend on early intervention prevention. And whilst the overall spend, I'm paraphrasing now, is broadly in line with where we'd expect other councils nationally to be, almost all our resources are spent in the children looked after space, and we are the second lowest nationally in the early intervention and prevention space. So the envelope overall is broadly right. We've just got to move what we're spending that money and resource on. Now that's a challenge in itself, because we can't just turf young people out of their homes and provision. Absolutely, that's impossible, isn't it? So we need to safely work our way through where we engage them and their families and their communities into this space. So this is the dilemma we find ourselves in terms of delivering the transformation that Natasha's set out with us, financing that, and actually making this all add up. What I will say, the opportunity is that actually we've got the improvement plan as a council now to be able to do that. And one of the things that we're really keen to do is to align all of this work within that overall council improvement plan. So when we talk about actually what's the role of housing, what's the role of infrastructure colleagues, also and others, actually we've got the right people in the room that are decision makers to have those challenging conversations with and about. So if we can bring that impact back, I think that would be a really useful update to provide to committee in the future.
Thank you, Councillor Dean.
Thank you very much. Just 3 points. First of all, I'm not actually sure I agree with Susan. I think that there's an issue with long reports with lots of detail. It makes it actually really hard to scrutinise. I'm not a regular member of this committee, but I remember feeling the same thing last time I subbed on this committee, and so I'm a bit concerned about that. But I actually thought your challenges at the end were fantastic, really helpful. And on the impact board one specifically, I was just wondering, the way round you were putting that was that we could help to feed into the impact board, but it sounds to me like we should hear from the impact board. I'm wondering whether that's something that would be useful for this committee to actually have the impact board come along and talk to us. That was the first point. The second one was in terms of multidisciplinary teams. So, these are made of people. Are there examples where they are working? Because in the end, you need to be building out coalitions of the willing, don't you? So if you're talking, police, health, education, childcare, we're talking about a specific police person in a specific area, a particular GP, a particular school. Are there places where we are bolting together those multi-agency teams successfully, where that good practice is then being shared through their routes as well as through our routes? So I'd be really interested to know if we're able to do that, and if we're able to then spread that good practice where we're putting those teams together. And the third thing is just about physical places. You talked about co-location. I read something interesting about work in Birmingham on economic development. It actually was, and it talked about how in one area, it was all based in a community centre which people trusted. People walked in and out of it, and it worked. In another area, it was all strategies on paper, and it didn't work. And so that physical location where people are coming together, where people feel comfortable, where it's do we have those places? And if not, is there a plan to get those places into the market towns where we need them to make this stuff work? Because people need to literally know where to go physically, don't they? Both in terms of multi-agency teams, but also in terms of the families and the young people. So, do we have a building strategy effectively to support all this?
Okay, in order then, impact board, I would love you to hear from the impact board. Absolutely. Yeah, you would have my backing for that, because ideally you need to hear frontline from the children, young people and families, so that actually it starts to influence the work that we do. So yeah, by all means, I'd love you to have them here. We've got a session with them in January, and I will, tell them that you were asking about them, because I think it's a really good idea. Second one, in terms of multi-agency child protection team. So unfortunately, this is a completely new concept. So we are literally growing from a standing start where no authority in the country has been doing it. What we have got.
So just because there was that, but there was also multi-agency teams for the early start stuff, wasn't there? Yeah. So on.
Okay. So yeah, so the multidisciplinary team, yes, we do. We have some really good practice, not only in Shropshire but across the country, and we share a lot of that with our colleagues across West Midlands fairly regularly. So we do have some really good examples of where we've got good co-location starting to happen. I think what it's important to remember though is the needs of Shropshire are different, and not only have you got like one need in the whole of the area, you've got different needs in different pockets of community. So I think it's really important that we take the good bits from the areas where we've got some commonality, but we don't feel inclined to lift and shift something that won't work for us. I think, for example, when we've looked at the needs and harms analysis, in Shrewsbury, we've got different issues that are really quite concentrated and will need more police involvement, I think, than you might need in somewhere like Ludlow. So I think we need to reflect that back into our co-located teams. What I would say about the multidisciplinary teams in terms of good practice is, we've got some really excellent partners working in Shropshire. Some people who are really willing and really want to be at the front of design, helping us to design and deliver what this needs to look like. And we've got some great schools talking to us about, delivering co-located parenting programs in childcare settings, wanting to be part of the family hub development and making sure that we've got access to co-located teams on site. But we've also got some people who are standing at the back, probably reluctant to get involved, maybe watching and waiting, to see what happens. So I suppose for me, it's about how do we make sure that we galvanise the people who are ready and willing, but also think about how we bring all people along so that actually we're meeting the needs of all communities. Because I think what came out from the feedback from the stakeholders was that sometimes we'll push on with the good people, but we won't actually really get underneath the skin of where we actually need to bring people on. And I think there's a really critical part of this where we need to say, actually, the areas of most need are X, Y, and Z, and therefore we need to make sure that regardless of whether people are ready and willing, we need to be working in this way. And that's why we've tried to make sure that the governance aligns back to that ambitions board, so that actually we've got the support of senior officers who can help us to kind of get that partnership commitment. If I'm really honest, you know, some of those challenges are starting to come out, but I think it's healthy that they're coming out now rather than us not talking about them. So yeah, we have got some good practice that we can learn from. In terms of the places, it's a really interesting question, and it's interesting on 2 points really. So all of the change that DFE are initiating is much more centred in the voice of children, young people and families. So traditionally, if I was operating in this council 3 years ago, I could have looked at some guidance, gone away and done something that I thought was the right thing to do. But actually these reforms are saying, actually, it's not for you, Natasha, to sit in a darkened room. You need to work with those children, parents and families and make sure that you go into the spaces that they need most. Now, I think that's going to be a challenge for us because actually, A, we might not have the buildings, B, they might be expensive, you know, so it might present all kinds of challenges to us that will mean it's more difficult to do that. That isn't to say that we shouldn't try, and I do think we should, and I think it might need some support, you know, like I say, corporately and from members to make sure that we can achieve some of that. But I think it is really important that if we don't get the places where people go to, they won't get used. So for us to make some of this shift, it will mean trying to work through some of that. A really good example is the Best Start in Life Family Hub site we've got to select. We've been looking at the data. It's identified a number of areas that are in the areas of deprivation where we've got, you know, low levels of attainment when children get to school. And actually, the places where we've got spaces are not necessarily in those areas. So at the moment, we're trying to walk around the places to try and find the most suitable place. So I think, yeah, it will challenge us undoubtedly as we move through the process. But I think it's important that we try and find those community buildings that people are in and want to be in so that we can make the programme a success. Because I think the existing strategy hasn't worked for us. You know, we've tried to get people to come to us and it doesn't always work like that.
Plus we got the additional challenge of being so rural as well, and so diverse. You know, you remember selecting a building in a location with the whole of Shropshire to look at. And I think that's going to be a challenge as well, is to ensure this is rolled out through a central resource, but to all aspects of. So working sort of multi-agency, even with the fire brigade, who the first-hand experience different areas with the schools and other sort of areas, is fundamental for the whole project, really, isn't it?
Yeah, and I think that's why the schools are so important, but I think it's also why we shouldn't lose sight of the outreach. So a lot of the work that we do will be in families' homes day in, day out. And so actually we shouldn't lose sight of the fact that there will probably be people in these rural communities that are accessing our help and support all of the time. So it's making sure that we twin track both the buildings, but also that access to that help and support in the family home if it's needed.
Final question before we finish.
So I actually want to pick up something you said about basically the childcare services actually become more complicated. I completely agree with that, because at the end of the day, it's since the dawn of man, it's never just been the parents in regards to childcare, it's been the wider community. One thing that I did experience working in charity was that the partnerships that council would have actually allows the partners to be a lot more agile about resource allocation, and obviously with the changes of how the resources would be post-report. Is there more of an availability for that agility regarding resources, and is there more of a capability in terms of having a more holistic approach, which obviously what this report's basically going straight into? Is there more of a capability of obviously moving that depending upon the geographic location, so that when it's more of a rural area, is it possible to actually move resources around based upon where they would actually make most impact, not just a widespread allocation? Because as a majority it makes sense, but when you actually start looking at it, it would make more sense to actually alter those resources based upon the locality rather than the average of the county.
I think that's a really important point, actually, especially given the challenge that David talked about in terms of the low amount of funding that we've got. So a lot of the guidance is talking really clearly about using the evidence and data we've got to target our resources in the areas most in need. And so that does mean undoubtedly that there will be some areas that aren't prioritised for this support because actually there's not the highest level of need. And so I think there is that agility. I think it's incumbent on us really to make sure that actually we're looking at that data, we're taking into consideration the variety of needs that might be here in Shropshire and not necessarily the ones that might be more apparent in like an inner city, so that actually we are making sure we get to the people who need our help and support. But I do think that's why the strand around digital and data is so important, because actually in the local authority where I've come from, I had access to a click of a button household composition data on a family that could tell me the level of risk that was attached to that family. And actually that can be a really important tool in terms of helping you to use your resources effectively. And we don't have that here. So I would really like to see, as part of that corporate improvement plan, us get much sharper at that, so that actually we can target our resources effectively, working alongside partners to make sure we meet that need.
Thanks, Chair. As a taxi driver, I have to, when I renew my licence, I have to have a safeguarding course within 12 months. Now, something I've just thought, I was reading here about the safeguarding. What about minibus drivers? Because they're licensed through DVLA, so their licence totally different. Has the council got any control over those drivers being safeguarded? Something I've only just thought of.
No, so I think that, so in terms of response, within our home to school transport network, absolutely, 100%. I think the wider aspects, we'll pick that up and come back to you with a response, actually. It's a good point. Yeah. Yeah. So we're doing a lot of work around consistency around training, so safeguarding training for all multi-agency partners. So that is something we would expect anyone who engages with children, including after school clubs, before school, that type of thing. But we'll specifically pick up this query and come back to you, Councillor, if that's okay.
Yeah, I think that's very pertinent as well for things we'll discuss later on this evening as well. So I think that will feed in really nicely to this. And finally, Councillor Morgan.
As a portfolio holder, I should probably know all of this, but there's so much in this, these reforms changing. I come up with questions every day. So apologies, Natasha. I just want to ask you, you very clearly identified, that there are partners, statutory partners who are at different places in the journey. From the Pathfinder progress and reporting, the local authorities that were part of those Pathfinders, did they find that? And do we know how they tackled that to bring everyone forward together?
Yeah, so we're part of a West Midlands regional group which is focused on the development of Families First Partnership. So we have a really active network where we can talk about things like that. We're really lucky that Walsall, Wolverhampton and Warwickshire have been Pathfinder areas and have been really open about sharing their experiences with us. They have all certainly, I think, identified where there have been some trickier spots and some easier spots where actually it's worked either effectively or not. It hasn't been consistent, so it isn't the case, for example, that police and all local authorities haven't been engaged. And so I think, again, it depends on that local context and what's going on there in terms of how well people have engaged. But certainly we've had conversations with, for example, police came and did a presentation at Walsall about their engagement of police colleagues, and they invited our police colleagues to attend that with us, which was really great, actually, to try and help police hear from other police colleagues about how they've implemented the reforms and what it might look like for them. So I think it's been really nice to have that network, but also to watch that network grow and evolve into that partnership space, because traditionally it would have been a local authority space. So yeah, we have got access to that if we need it.
Thank you very much indeed for your time, and thank you for that very detailed report as well. You mentioned the role of scrutiny actually sort of holding you accountable for the whole sort of strategy nest. Are there any particular areas you'd like scrutiny to support you with further?
I think it would be really helpful if we could make sure that we've got a conversation with the Safeguarding Children's Partnership at some point. I know they're due to bring their annual report, which will include an update on the threshold document and how that work is progressing. Personally, I think that's really important. At the minute, it describes how you get into local authority children's services, but what it needs to do is describe how the multi-agency is going to help protect children from harm and not just local authority. So it would be really helpful if you looked at that area. I also think it might be helpful to have an update on progress probably 12 months from now, terms of all of the aspects of the programme.
Because you've made great ground so far, and the fact you've engaged so many different sort of agencies and partners, I think it's very admirable what you've done so far, the work you put into it. So in 12 months' time, to see where we progress from there. But in the meantime, look at the safeguarding aspect at the same time. Thank you very much for your time. Thank you. We shall now move on to the performance report.
Thank you very much, Chair. So committee, this is our standard performance monitoring report for Q1. It is a long and detailed report because it covers a wide range of services across care and wellbeing, which is adult social care, education and children's services. The format of the report is a report that we've not really changed over the last few years. It came out of the People's Directorate when it was one directorate over adults and children. So just taking on board Councillor Dean's comment, we could actually split this report in two, and I think that would be quite sensible. We were discussing this earlier, that we must make sure that we balance the reports out between the kind of different service areas. So we can take that forward, colleagues, can't we? But for the purpose of this report here today, it covers the Q1 reporting period. So as we've done before, Chair, I suggest we ask each officer to do their summary report, expecting committee to have read the report in full before committee this evening, and then we take questions per area. So we're going to start with John first of all in terms of education, and then John will pause, take questions, and then we'll move on to Joe. Thank you.
Thank you very much. My portion of the report starts with the work around the Dedicated Schools Grant. For those that may not know, the Dedicated Schools Grant is made up of several blocks. The schools block, which determines the money that individual schools get, the early years block, which is around the resource that goes out in terms of providing early years education, childcare, the high needs block, and the central school services block. The particular pressure that we've experienced has been in relation to the high needs block, and there's been a good deal of publicity. Shropshire is not unique with respect to high needs block pressures, but what we've noted over the last 3 years is an acute pressure, which means that we are currently running at a deficit of £41 million in that block. It's worth noting that this deficit sits outside of the council's budget sheet, so this is not related to core council funding. This is separate. There is a statutory override which keeps this deficit off the council's balance sheet. That statutory override runs out at in the end of March 2028, and we wait information from the government to determine what the future of that override. But Shropshire is by no means unique in the pressures that it faces with respect to the high needs block, and it's been well reported by the National Audit Office and others around the level of pressure. Collectively, as I've noted then in the report, councils face a debt of around £18 billion by the end of this Parliament as a result of the pressure. That pressure is as a result of the high needs block. So unpicking the reasons for that, it's very clear that the high rate of EHCPs, education, health and care plans, have contributed to this pressure, not just in Shropshire but across the country. We've seen the number of EHCP plans increase by 70%, December 23 to 25, and again that reflects the picture across not just the West Midlands but across the country. The pressure has been seen in a number of areas. We've seen the pressure increase in terms of the amount of resource that is spent in independent schools. So those are the specialist schools where we need to support children's needs with the most complex needs, and we've seen that increase from 178 pupils in 2019 to 521 in last academic year. We've also seen the proportion of pupils who are supported with EHCPs in maintained schools and academies also increase similarly. We've also seen the need to increase the top-up fundings for mainstream schools. So we've also recognised the need to ensure that we support schools properly where they have children with additional needs. And it's absolutely right that we do. Part of the strategy in addressing this deficit has been to also provide that investment into mainstream schools. We provide we've developed a number of resource provisions, which you may hear called hubs in Shropshire. And that's about supporting children's needs most appropriately at local schools, because it's not in children's interest to move them vast distances across the county in order to go to school. And children's needs are best met in local schools as closely using in inclusive classroom environments. So we have seen the top-up funding to mainstream schools increase considerably over the last 3 years. We've also, again, seen the increase to special schools also increase as more and more children with more complex needs need those places. One of the strategies that we've looked to do, we've met with colleagues from the Department for Education specifically around this deficit. I've noted previously in the report that the Treasury announced in November that the government, in order to be able to manage the significant deficits that local authorities face, will seek to be able to provide a solution to be able to address the acute financial pressures that local authorities are currently experiencing. But we haven't received any details about what those changes will, the form that those changes will take. So it remains incumbent on us to be able to develop a strategy to manage that deficit. We met with colleagues from the DFE with that particular focus, and we took them through the strategies and the various steps that we intend to take in order to be able to bring that DSG deficit to a managed position. Reversing it is challenging. We also noted as well in the recent audit report on the council by Grant Thornton that the council should continue to drive forward that piece of work around the management of the deficit to ensure that council, both within this committee but also through Schools Forum, is appreciative of the strategies that are being taken by ourselves and Learning and Skills as an approach to be able to manage that deficit and to reverse it, regardless of the work that happens to be coming from local government, from central government, because that remains to be seen. So I've outlined from paragraph 6.25, from 6.21 rather, the pieces of work that are being undertaken to be able to manage this deficit. And scrutiny plays a really important role in being able to hold us to account with respect to the actions that we've planned. We've appointed a dedicated school DSG management officer who will spend a day a week looking specifically on this DSG situation, drawing together the data from the EHCP team, scrutinising and modelling the pieces of our projections around how we will seek to be able to bring this situation back to balance. We're also looking, and we've also got in place, and my colleague Lisa Taylor reflected this to the committee last time, an annual review recovery team. Part of that team's remit is about bringing children back from expensive independent special schools to be able to find more appropriate settings for those children, both within state-funded special and also within our resource provision and within our mainstream schools as well. This is not just about cost savings. This is about ensuring that children's needs can be most appropriately met close to home in high quality local provision. We are also providing resource to be able to be focused on short-term intervention, because we recognise that it's in children's interests to get early support so that they're not languishing on waiting lists, waiting for support, where early intervention and short-term funding can close gaps and be able to ensure that children make progress. We allocate this in two ways. We provide an early years inclusion and advice forum funding grant for nurseries and for schools. And we also provide graduated support pathway funding to schools as well. The purpose of that is to be able to be able to close short-term gaps that children may have without the need for them to receive costly EHCPs, which once they've received are challenging to be able to reverse and to take away. We're also providing additional resource through our early years SEND support officers to ensure that mainstream schools are well supported to be able to support children's needs and make a smooth transition from nursery settings into mainstream schools as well. So this piece of work is not about preventing children from getting EHCPs, but rather it's about ensuring that children are getting the right support at the right time. It is more cost effective to provide that short-term early intervention than it is to be able to pick up EHCPs later on in a child's school life. The other piece of work that we're engaged in is investing in mainstream inclusive practice. We recognise that in order to be able to support children's needs well in mainstream schools need to be skilled up in order to be able to do that. We've invested in our resource provision. We've ensured that we're building a network of SEN hubs to be able to ensure that we can support children's needs close to home with well-trained staff. This investment is paying dividends. We've received very positive feedback from parent carers as well as from schools themselves around how that network is growing and how they're responding to the support and the training that's being put in through our education quality advisors. This goes hand in hand with central government's vision around inclusive mainstream practice. From November, a new Ofsted inspection framework was launched and it placed inclusion at the heart of it. There is an expectation that schools provide an inclusive environment for all pupils, and the support that we're providing through our education quality advisors who were appointed a year last September are making a real difference in being able to build that capacity. Another piece of work that we're engaged in is around the development of banding levels. This again is around helping us to be able to support inclusive practice in school and build a system which is fair and transparent in terms of the resources that schools receive. We've also increased the challenge and the monitoring of independent and state funded provision. I've provided a copy in the appendices of this report of our new education excellence strategy, which is currently a working draft, and we're developing as we implement that piece of work. Within that are the quality assurance checks on the independent and state funded specialist provision that we commission, as well as the unregistered provision which is provided through alternative providers. This is ensuring that children's needs are met in the best places, and that where decisions are being taken about the placement of children, particularly in respect of unregistered alternative provision, those decisions are being made in the best interests of children. A piece of work with respect to Schools Forum is in terms of a block transfer. This provides the opportunity for us to transfer a portion of that schools block back to the high needs block with the approval of Schools Forum. And we have the ability to transfer 0.5% of that block back into the high needs block. We're looking at what impact that will make. We know that we provide a lot of resource already to schools through the grants and through the mechanisms that I've described, such as GSP and the Early Years Intervention Grant. So we're modelling what impact that will make in order to be able to explain to Schools Forum the various the merits of such a block transfer. But that would transfer in the region of £1 million back to the high needs block. So I don't want to necessarily oversell the impact of that. What we will continue to do is to monitor the impact of those interventions. We'll monitor the impact of those of the transition from children from independent schools to more cost-effective provision. But the key word is around the effectiveness of the provision. This is not just around a cost-saving measure. This is also about ensuring that children's needs are met in the most appropriate places by ensuring that there's those effective checks and balances that we'll seek to put in place. So that will take us to 6.51. I'll pause there and pick up any questions that you may have in terms of the DSG aspect.
Councillor Duncan.
Right, okay, I'll start again. Thanks for the report. You know, it's very detailed and very helpful, I thought. Just a couple of points in relation to the DSG deficit. Obviously, we're waiting to see what the bailout might be. If there is one, indeed, you know, it might be written off, it might be partially written off, could be converted into a long-term loan. We don't really know what's going to happen. So are you doing scenario planning, I suppose, for that, so taking all those different kind of options into account? Is there a DSG management plan? I think it is referred to in the report, but it isn't there. So it might be really helpful to actually be able to see that. That's just one point. And the other thing is, I was just wondering on the decision for the Schools Forum really to have oversight of that management plan and what the thinking was behind that decision. Because my understanding is they're more of an advisory board rather than having accountability for sort of the council's finances. So I didn't know whether it might even be more appropriate for it to come to this committee or audit or whatever, but just some of the thinking really around why it's going to the Schools Forum. And then just in relation to the EHCPs, the report does state that staffing capacity, obviously, at the moment, you know, is not. It doesn't really support the ability for us to be compliant. So one of my questions is what, you know, what permanent staffing level is required for us to be compliant. And another thing around the out of county reviews, I know that these are being prioritised at the moment. And I'm again just a little bit of clarity around the thinking behind that, because that seems to me to be quite a sort of high safeguarding risk actually, and maybe there should be other priorities that maybe decide which plans are reviewed first. Sorry, there's a lot of things there.
That's all right. I will try and remember the aspect that you covered. If I don't pick that up, do come back at me. In terms of the modelling aspects around the various scenarios, you're right. It remains to be seen as to what the actions by central government will be in terms of DSG. We could spend a lot of time hypothesising about what that might be, and spend a lot of energy on various permutations which may not come to fruition. I think it is time better spent looking at the situation in the here and now around what bringing the current situation back to a balanced position. You can see with respect, for example, in terms of the spending on independent schools, we've started to reach the top of the curve, to steal somebody else's analogy, around what that looks like in terms of the level of spend that we're currently committed to in terms of independent schools. So I don't want to necessarily suggest it would be useful to try and second guess what the Treasury would look to do in terms of the approach that they might adopt. In terms of the aspect around Schools Forum, David, I'm going to hand over to yourself, if that's all right, in terms of that
Yeah,
aspect.
no, thank you, John. So I think just for clarity, so Schools Forum, whilst it does hold an advisory role, it is a formal committee of the council and does make formal recommendations into council. So, for example, every single year we as the local authority engage with Schools Forum. There is agreement around the funding formula for schools, and Schools Forum agree that, and then a report is taken into council to approve. That then triggers us being able to issue the funding settlements for maintained schools, and similarly that enables us to provide the levels of resources to share with the DfE, and they can issue those settlements to academies. So that there is a formal role there in terms of Schools Forum. We also have a specific subgroup, John, don't we, that actually has oversight of the DSG management plan, and as part of our good governance we are also going to report through the MTFP programme into council, both the actions that John's articulating in this report, but also an overview summary of the DSG management plan. So actually we want to be able to share visibility with that. We've got no issue with it coming here at all, Chair, Vice Chair, if that's your desire, we can certainly share that. I think we're just going to be really important we're not double boiling things in terms of different committees. Actually, it's really, really important. I'd echo John's concern that I don't think at this point we can quite second guess where central government are going to go with any of the wider modelling. All we've had is at the end of March 28, the balances will be covered within the departmental expenditure limits. We know no more than that at this point in time, or what that looks like.
With respect to Schools Forum, the other observation I would make is very often schools will try and lobby us for additional resource in terms of being able to increase the level of high needs funding they will get. And I think we've got to be realistic about what's caused this increase as well, because one of the increases has also been as school budgets have felt a pinch. So similarly, schools will look to EHCP top-ups as a way of being able to augment a budget. So it's useful through Forum for schools to be appreciative of the challenge that we face, that when we are making decisions which they may feel is unfair or mean, it's born out of the fact that actually this is from a limited resource that is already run dry. So it's absolutely right that we ensure that schools are appreciative of the acute financial pressures in relation to that high needs block, which is why getting them involved in that work around the management plan so they can see under the bonnet that actually we're not hiding anything here. This is a pressure as a result of that increased number of children with respect of EHCPs.
Thanks, that's really helpful, and that's helped me to clarify as well. So, but it would be really helpful, I think, for the plan to come here. So yeah, thank you.
Thank you. Two quick questions. Would you say that EHCPs correlate with an increase in required resources from the council? So obviously it would affect funding for the school, but is there actually other services that the council provides that have to effectively kick in once an EHCP has been allocated? And secondly, well, my question was along the lines that I think you've already sort of answered. Is there a correlation between the EHCPs in terms of what's causing them? Is there something behind the scenes potentially from schools actually trying to seek funding due to it, so they're far more observant of when there might be a case of EHCP, or is there actually something else as well that could potentially be causing there to be a need or an observed need suddenly kick in for EHCPs that has actually now caused this quite significant spike in actual allocations?
If I could just come in there. Yeah, in the actual report, there's a whole breakdown, which we asked Tanya for last time, on the reasons why the children got different EHCPs. So there's a whole detail, but it's actually broken down into finite details for age, which is really quite interesting, on ages and the reasons why children are getting it. I suppose your early identification is children with more complex needs coming through the system as well. So there's that as well. Thank you.
Yeah, thank you. Yeah, the increase in EHCPs is a result of the significant increase in the proportion of children with SEND. This is a phenomenon that is not unique to the UK. It's been noted across Western Europe, the fact that children with SEND have been on the increase. and there are myriad reasons why that's the case. Sorry, just to with the first part of your question, do you mind just remind?
So once an EHCP is put in place, is there actual resources that council must then allocate? That's not just financial.
That's helpful. So to be clear, the high needs block element of the DSG is for the education element of that EHCP. So that high needs block does not cover the social care element, and it doesn't cover the health element. So with respect to council funding, that would be met from the social care budget with respect to the elements in terms of an EHCP where there's a social care dimension.
What I'd like to, over time is racing on, what I would like to recommend is that could we have a briefing for all members on the DSG? It's quite a complex thing, the way it's broken down into your high needs category as well. So I think it'd be quite useful for all members of council to develop an understanding. Dedicated schools grant, Mr. Palmer. You know, there's another acronym we've used there. The money which is allocated to a local authority, which is then sort of handed out to schools for different reasons. I think it'd be quite useful for all of us to have a briefing on the DSG. I think we've got so many questions, but if we can move on to the next stage now. Any final questions from any members, please? Just agree that we're quite happy with the recommendations which are in the report, and so the recovery plan which is going forward, are we all quite happy with that? It seems quite logical and quite a structured approach. And in 12 months' time, perhaps go report back on the success of that. Thank you.
Thank you, Chair. So Jo Kelly, Head of the Virtual School and Access to Education. Thank you for asking me to present on elective home education today. What is EHE? So it is elective home education, just getting over those acronyms. And it is about suitable and efficient full-time education where a child is not on a school register and parents resume full responsibility for the child's education. And the most significant reason given often, apart from unknown, is philosophical reasons for parents choosing to home educate their children, and also mental health. So I thought that might just be useful to set that context. Education, elective education, home education is in the national limelight, and rightly so, especially for the learning from Sarah Sharif recently with the Child Safeguarding Practice Review. And although many young people are successfully home educated, we know the risk is where children are not being visibly seen when they're not expected to be in school every day. So safeguarding runs through the veins of the Education Access Service as a result of that. Our team in the Education Access Service, I'm very proud of them. We restructured in the autumn of 2024, and what we created is some blended roles to support children who are electively home educated with their status that changes sometimes into child missing education, and also trying to help them return to school. So our inclusion support officers have that focus on whatever status, tell the story once for the family, not multiple times, and the right support, right time, right place. So we're trying to be very child focused and reflective, and we did hold indeed a learning session in December following the publication of the Sarah Sharif review, so that we could swiftly respond to any learning points ourselves in Shropshire and help us evolve practice there. I just wanted to note in the report that in terms of the Shropshire rate for EHE, it was slightly higher than national at 1.4%, but was in line with our statistical neighbours. And then numbers nationally also have been indicated to be rising since then. Shropshire at the end of September had 711 children on elective home ed, and we have 791 today. So we are seeing a trajectory, and we are monitoring that carefully. Chair, you will note that I've identified that in the risks section of the report. The census is this month for EHE, and we're preparing our data for submission on that. The trajectory obviously provides us with a challenge in Education Access Service. And I ask our team how we can work smarter to support continued high quality service to ensure our children are safe and have a suitable education when they are electively home educated. And we have moved to virtual visits where that is felt appropriate and safe to do so. But to reassure as well, Chair, children who are on child protection and CHIN plans are also given priority of a home visit within the first few months of being electively home educated. So we are working smarter and trying to make sure we prioritise safety. In the report, I put a link to policy for you. This currently actually is in revision, and Davies just reviewed it a couple of days ago, so it's ready to go to Safeguarding Board near the end of this month. And why I'm telling you that is because it's important for me to note for you, it reflects our increased safeguarding in preparation for the Children's Bill, and also our increased involvement with health. So for example, where our children electively home educated may not have all the signposting for vaccinations, and also that learning from Sarah Sharif. So that is with Safeguarding Board for the end of January. Also really important to note is Shropshire, I think, having compared ourselves to some other local authorities over the last month when revising the policy, I think we're ahead of the curve. In preparation for the Children's Bill, we already added in our expectation for children on child protection plans to return to school for their safety, or for EHE not to be granted as part of the child protection plan, unless there are, because we are human first, exceptional reasons for that, because it's always about the child's best interest. We have worked closely with child protection chairs to embed this practice over the last 6 months. And working together fortnightly meetings. Working together is a kind of the title of those meetings, and I chair those where we have a focus using data to look at vulnerable groups such as children who are electively home educated and on child protection plans. That has oversight from Sonia and David, so our strategic director and DCS, because they come into those meetings too. So we have that very good oversight and a swifter action. So just to conclude, in terms of success, 2 of our practitioners recently received Gold Kit Awards. This is an independent award, and that's the 3rd year in a row that one of our case officers has received this award. So that's lovely, you know, in terms of celebrating in our team. And certainly as part of the Ofsted inspection, they identified good practice for Shropshire for EHE as part of the outstanding judgment. However, we are always looking to evolve, and it's a continually changing scene. Thank you.
Thank you very much, Shelley. And it's, I think the way you've brought safeguarding into it as well as sort of main feature of it as well, I think it's very pertinent as well, to make sure children are safe when they're at home. Like you said, we're not quite sure where they are, what's actually happened to them. Did you see a rise just quickly after COVID of elective home ed?
So I have got the data going back, although I wasn't in post at that point, but 2022 to 23 we had 539. So you can see as today we're at 791. What I haven't got is the pre-COVID in front of me, but I can get it if needed. That's all right.
So, thank you. Councillor Hall.
Thank you, Chair, if I may. Just on 6.79, the vulnerable group table around home education. We all know that children in free school meals need that hot meal, and I just wonder how they're supported with being home educated when they're eligible for free school meals, and are we confident that they are receiving the correct nutrition and food, really?
Thank you, Rose. As I said, safeguarding runs through the veins of education access. However, children on free school meals, once the parent makes the decision to electively home educate, then they assume full responsibility financially and delivery and for providing a meal for the child. So the free school meal status continues in terms of our monitoring. However, it doesn't continue in terms of our duty to provide. We make sure that we track this group as part of our data, because we think it's important when we're looking at how do we help children return to schools when it's the right thing for them. So we have that in mind.
Any further questions? Thank you.
With you mentioning that, that kind of sounds like a recipe for potential disaster, that these children disappear from, you know, from mainstream school, and you've got the potential that they're in a situation where they're vulnerable and they're not being fed properly. And over the years, there have been a number of horrendous cases, as we know. You know, Victoria Climbié springs to mind, just in terms of abuse and so on. And every time that happens, oh, we've learnt lessons, and then it happens again and again and again. And we're sitting around here talking today, you know, and is there a chance that somebody in Shropshire we're going to find somebody who's homeschooled, who's not being fed properly and receiving other things? Is that something that could happen here? Are we monitoring that closely enough?
Thank you for your question, Susan. In terms of things that may be possible to happen where children aren't in visible sight, then it's evidence that it could happen. So one of the changes that we have made to policy, in addition to the Sarah Sharif learning, which includes domestic feedback loop, for example. So we make sure we check our systems across the council, everything we have available to us. Liquid Logic, Early Help Module and Synergy are our main focuses for information. And whenever a child comes, a referral comes in for EHE or notification, we always check all of those systems for example, domestic abuse history. Has there been any early help intervention, any targeted support, any previous episodes of child protection, neglect, for example, so that we then have a multi-agency discussion at that point, and as a group with targeted early help and ourselves, we look at whether we need to actually refer in at that point to a MARF, a multi-agency referral form for safeguarding, and whether or not we move that direction or whether we move into early help advice and support. But through a child being electively home educated as well, we continue to work closely with social care and EHAS. So, for example, through the working together meetings, because it's possible for that sort of scenario to happen, but we want to minimise every risk possible for it to do so.
Have you ever turned down a request for home education based on some of that information?
Yes, we have. Yeah.
It's a very pertinent point you raised, and it's something that's been a concern for many, many years. But as soon as the child's out of the school system, you know, what checks are being made as well. But I think, you know, the local authority are fully aware of the risks there as well. And I didn't realise we did a risk analysis prior to them and doing Homehead as well.
If I could just come there as well, Chair. So it may be, if you are particularly interested in this, the last review and child safeguarding practice review that the National Panel published around Sarah Sharif's experience, I think would be worth you reading, because what they identified in that learning review was that even with the proposals that are going through the Parliament currently in terms of the Schools and Wellbeing Bill, that will not or would not have impacted sufficiently strongly to change the direction of travel for Sarah. So I think we've got to reflect really strongly about that, actually. So what we're saying is essentially the law is not strong enough to stop a child from experiencing significant harm. That can't be a place that we're comfortable experiencing. So I think there's reflection within central government, and obviously clearly conversation within the National Panel and government around that. And I think that's perhaps what's delaying the movement and progression to royal assent for that particular bill. So I think for Shropshire, we are ahead of the curve. We would want to go further. The challenge we face is the law prevents us from doing so. So we are unable, in some instances, to stop a parent exercising their legal duty over their children. We may not have a legal right to do that unless we take safeguarding action against the parent.
No, I just want to make sure, thank you, that we are doing everything. We recently had the health and everything workshop for members. I think it was about 20 of us went on it in the end, and looking at health in absolutely every aspect of everything that we do. And we talked about other partners, police and fire and things like that. But what about people like the people who empty the waste bins, you know, they see things, they go to the same houses every week, they see things, they observe things. Do we talk to them about using their eyes and ears? You know, everybody should be using their eyes and ears all the time to say that doesn't look right, that doesn't sound right. You know, are we doing that? Are we making sure that we're using absolutely everything? The milkman isn't there these days, you know, so we've got to use somebody else.
Sonia. Okay.
Just in brief, we've had several campaigns where we've worked with the refuse collection through the contract there to kind of do that, and with the postal service, and we started that through COVID, but we do utilise that space.
Final question. Thanks. Quick one. I see that it's the third most likely reason for elective home education is mental health. I'm just wondering, is there any checks or anything to see should a parent decide to bring their child to home education and their mental health actually decreases as potentially as a result on that, or for whatever reason, is there actually checks in some way to make sure actually we should have a discussion with the parents and say, look, that wasn't a solution, let's look at bringing them back into education but in a different means? Is there anything like that?
Thank you, Thomas. At the point of notification that a parent wants to take their children out of school into elective home education, the education welfare officer works with the family and the school to see if there could be a return to school, if that is felt the right path. So we do acknowledge that a lot of families do incredibly well and work safely in supporting their children with home ed. I just wanted to make that really clear. But also in terms of mental health, if at that notification there is mental health, then certainly our education and welfare to be signposting, as well as trying to encourage that safe being in school every day so that they are seen and accessed. If the parent makes a decision still to go ahead, as is their legal right, then we have a welcome pack that includes a wealth of health information, not just about vaccinations, but a whole kind of social prescribing, as well as things like Couth, which is free to children and young people. So we're trying to increase that because we recognise that it is our third most significant reason for parents choosing this.
So thank you very much indeed for that detailed report as well. Thank you for all the work you're doing.
Thank you.
Good evening, Sonia Miller, Service Director for Children and Young People. I'm going to present very briefly to you the overview and summary of the fostering development part of the performance report. So the last committee asked for a more detailed focus on what we have done and achieved in relation to the fostering transformation programme, because obviously one of the key areas for us in Shropshire is making sure that we have sufficient foster placements, foster care homes as opposed to placements for our children and young people. So the report starts with a national picture overview and summary, which essentially tells you that this is a national challenge and that there are a decreasing number of foster carers nationally. I'm pleased to report that we're currently bucking that trend, and that comes on further into the report. Our transformation programme has had 3 areas of focus. One has been on a increased detailed marketing strategy and driving marketing campaigns to increase inquiries and applications, and then converting those to actual approvals. The second part has been on restructuring our fostering service. So we're a registered fostering agency provider, and that we work with what you'll call, it's in the report, is mainstream foster carers. And then the third aspect of the transformation programme has been on recruitment, the retention, training and support offer to our foster carers. Because what we know is foster carers who feel cared for, valued, supported and trained and developed will stay and continue to foster. So there is a summary of the national picture, which is not, exactly rosy, but fostering remains a really important aspect of any local authority sufficiency strategy, because if a child can't live within its own family, its birth family with its partners, the next best option is that they're in a family environment. So within our mainstream foster carers, we have those people who are recruited as foster carers to foster children who are not necessarily related to them, and there are connected carers or kinship care foster carers who are recruited to care for grandchildren, nieces, nephews, cousins, etc. They are treated the same, the allowances, etc. are the same, the offer is the same, but they have a slightly different legal standing and their approval at panel is slightly different. So I just say that so you'll see the difference in some of the terminology in the report. The impact of the marketing strategy is detailed at 6.129, and we can really see that this impact is reflected on our children through the increase that we have of children currently living in children's homes. So where we've seen the national impact translate into Shropshire, and that the reduction in available homes, whether it be through our own foster care homes or whether it be through IFAs, Independent Fostering Association homes, which are essentially private businesses or not-for-profit organisations, we are seeing an increase in the number of children who are in children's homes, and that's reflected in the placement options in that table. However, conversely, we're seeing that we've got a much increased number of kinship and connected persons foster carers, and our approvals of those are high, and our percentage of children who are cared for in their extended family is high. And this is a real area of strength for us because children are able to remain living within their own extended family. Recruitment and retention of mainstream foster carers is integral to our foster care sufficiency strategy, and ensuring that children have the safe, loving, permanent home wherever possible in a family provides the best possible outcome for children, but it also carries the best value for money and the lowest cost available to us as a local authority. The cost comparator at 6.145 demonstrates this compared to the England's statistical neighbours and West Midlands neighbours. We still benchmark very low on what we spend on fostering, and that includes fees, allowances, support, our whole entire service. So we still benchmark very low, so we get very good value for money for our foster care provision. The fostering transformation has really increased the recruitment of foster carers, and you can see that this year we're on track to approve by the end of March 24 sets of foster carers, as we think that's going to be the highest in the region. The last meeting we were at, it looked like we were going to be the highest recruitment in this way. So we're really starting to see the impact of that marketing strategy taking place. It takes time to see that, so we had a significant increase last year and the year before, but we're building on that. It takes a minimum of 6 months from inquiry to approval, and that's the statutory minimum. It can take 8, 9, 10, 12 months for that assessment process to take place, depending on families' particular circumstances. We have made sure that our allowances are competitive and our fees and allowances are competitive. I think there is more work that we can do there, particularly around those foster carers who take the much harder to care for children, the ones that offer a bit more sort of like challenge, and significantly those that we might want to step down from residential care to a foster family. And we're continuing to kind of look at that offer and to see how that would help support foster carers. The training and development, as I've said, is a critical part of the offer, and the transformation programme is really focused on that, and there's a significant part of the report that focuses on that. Carers offer love, care, nurture, stability. That's what they bring as part of themselves and as part of a family, but they need a wide range of knowledge, skills, safeguarding, understanding and support to enable them to undertake what is a crucial task in caring for children, particularly when these children have experienced trauma, and a trauma-informed approach and a family environment is absolutely critical. But also them having an understanding of those children's individual needs. So if you're suddenly caring for a child with autism, you do need the right training and support to enable you to parent that child to meet that child's needs most effectively. So the last part of the report does detail the key areas of focus for the next 6 months, both in relation to the marketing strategy and recruitment, but also the retention of those. So those next steps are very clearly outlined. I am very conscious of time. I think it'd probably be better to focus on questions if there are any.
Just a question about funding for children in foster care. When does the funding end? Does it end when they're 18?
So in relation to their foster carers, yes, unless they stay, so they are able to stay, and it's a way of doing it called staying put, and therefore the foster carer and the young person can say, I want to stay in this family, and we can offer financial support for that at a slightly different rate. At 18, the children become care leavers, and so we are responsible for their accommodation as care leavers up until they're age 25, but that is obviously in a different type of accommodation, whether that be supported board and lodgings or supported living or working with housing to support them into independent tenancies. But the fostering allowances finish at 18 in that way.
There is a facility for them to stay in education. They don't
Yes,
have to
yeah, the care leavers offer, which is we have as a council and we're signed up to, it supports young people to stay in college, to go to university, to undertake apprenticeships, etc.
Brilliant, thank
you. Councillor Dean.
Thank you for that. As I understand it, there's an issue around the not just numbers, but also that the foster care cohort is an ageing cohort. Is, you know, do we have strategies for trying to recruit younger people to get into fostering? And as I understand it, there are places where, I don't know how this works, but where you can, where young adults are involved in part-time, providing weekend support, and that's a route into becoming interested in fostering. Are there things we can do around that?
Yeah, absolutely. So for Shropshire, the ageing foster care population has been a kind of issue because we've got some amazing long-standing foster carers, and we've still got them well into their 70s still fostering. In fact, at the award ceremony, we gave an award to a fostering couple who had just completed 30 years of fostering and well over 150 children in their care. However, the marketing strategy is exactly that. It is a strategy. So what we have done is targeted campaigns. So we've targeted younger families, we've targeted single carers, we've targeted those that may wish to give weekend or, you know, sort of short break kind of aspects. And I think that's what has been quite successful, is that when we've said that this is what we're looking for, so would you be interested in fostering some brothers and sisters together? Then we've had responses to that. Are you a single carer? Are you interested in fostering? We've had responses to that. If you've got a younger family, we can support you. Some of the getting the messages across about some of the perceived barriers, like you can't work. Well, historically that was the case. It's not now. The council's become a fostering friendly council. So when we employ people here who are foster carers, we give them support to have time off, to attend meetings, to be able to, you know, interact with social workers, etc. We're working with the NHS at SAF and with the NHS locally for them to be a fostering friendly employer, so that if you are working, you can have the support from your employer to enable you to do all of the fostering tasks properly. Something as simple as needing to pick a child up who's not yours, who's sick. The number of employers that wouldn't let you do that, but actually a fostering friendly employer would. So we've done some real targeted aspects in the campaign to try and recruit foster carers to the right cohorts of children. So one of the areas that we're focusing on at the moment is those that will take the more sort of like complex. So if you've got some kind of background history, if you're an ex-teacher, if you've got some experience of working with children, etc., it gives you that sort of step up in working with those more complex children. So if you follow Shropshire Fostering on any of the social media and continue to share all of that kind of stuff, that would be absolutely brilliant, because the more we can get it shared, the wider that campaign goes. And most of our families come to us by knowing somebody who knows something about fostering.
That's lovely. Thank you very much indeed. And we're running out of time. I would like to say thank you very much for our comprehensive report. I know your marketing campaign has been very successful, looking at the increase in numbers. I know Councillor Horton's been promoting it as well. And I think in our own constituencies, we've all been sending emails out promoting it as much as we possibly can to spread the word for you. Unfortunately, because this is an evening meeting, we have to finish by 8 o'clock. So we're running out of time, and we've still got the education excellence strategy left. That's and social care. So we've still got a few items left on the agenda.
No, Chair, if I could interject,
please.
if that's okay. So we've covered the performance Q1 for education and children's services. I'd like to suggest now we take care and wellbeing performance Q1, and then we pause the other paper, given the time that we've got, if that's okay, Chair.
It's a 5-minute briefing on the things. Okay.
Don't worry, that's fine. Welcome, everybody. Okay. So, I think we've identified the 3 key areas, hopefully, that you asked for this time, and hopefully reported those well. We've focused on our key review positions, which you will see that we've made year-on-year progress in the performance related to reviews. We know that we would need a significant resource to be statutory compliant, and as numbers go up and down, as people come in and out of service, it is a forever growing and changing number of people that do need a review. We are currently at 64%. I checked this morning, so it's gone up slightly. And the numbers have increased by an additional 300 people that have been reviewed since I wrote the report last month. So again, year on year and month by month progress there. We have action plans in place to continue with the progress around those that are overdue. We've got small numbers now dating back to 2022. I think all of those, bar a very small number, are in care home placements, with a large number of those having been seen visibly by a DOLS, a deprivation of liberty safeguards assessment, best interest assessor over a year's period. So we're confident that all of those that are overdue are RAG rated, so we know the level of risk against each of those people, and they are allocated in relation to level of risk and how long they have waited. So the plan is definitely working that we've got in place. Our out-of-county reviews, we've done a dedicated piece of work on that to make significant progress, and I have pointed out in the report that over 100 out of the 171, I think it's 109 to be exact, are located in one of our 7 neighbouring counties, so they are just literally over the border. In most places they've been placed due to family choice to be closer to family, with a small higher number of people placed further away due to meeting that complex need. Those are generally very high level specialist placements that we don't have in Shropshire. In relation to capital reduction demand, I know that's a real keen area of focus for members at the moment. We know Shropshire's a lovely place to live. People come here to retire, as our ageing demand demographics evidence. And with that, we see high numbers of self-funding clients approaching the council that need care and have been having care, but their funds started to drop below the threshold. With that brings lots of demands into the service. One particular demand might be that they've been paying for a really expensive care package or really expensive placement that generally they might not necessarily have needed. So we're really keen to ensure that we're working with our self-funding market to get them the right information and advice at the right time, to support with the commissioning of the care that they need so that they're purchasing the right level of support at a reasonable rate and they're not paying over those extortionate rates for care, which obviously then is using their capital much sooner than it would if we were supporting them with commissioning and sourcing that support. We've put forward a transformation project in relation to self-funders, working with partners such as Age UK to ensure that we can get information and advice out to self-funding market in the best way possible. So we're working with partners such as Partners in Care and Health Watch around our data as self-funders, because we're not clear on the exact demand in Shropshire at the moment, and the future demand and how we can map out how many numbers we might get coming in over the next 5 years, for example. So it's really important we understand that. You'll see in the report that placements, 13% of placements cost around £90,000 a week. So, generally really costly numbers there that we're really keen to try and reduce. We've got clear plans in place when people do approach us, and we do unfortunately need to look to move individuals. We look at risk assessments to ensure that we consult with their family members, with any health members that might be involved with them. to identify levels of risk. We work with providers to negotiate costs to try and prevent people moving as much as we possibly can, but it is about ensuring that we're getting people the right support at the right time rate, so that we know that we can support everybody in Shropshire with the budget that we have. You'll see following on that coming to scrutiny next month, a report and a new policy around deferred payments, which links really closely with capital reductions. That is where we support people where they've got their own property and they've made that decision to enter into a care home placement. So hopefully you'll see the link with that when that report comes next month. We were asked to report on the delay of providing services. We're not sure where that concern came from, but I've included some quite impressive data in relation to how quickly we are able to source care packages in the community and placements. We've got a really successful hard-working brokerage and bed hub team that work with over 150 providers across Shropshire to source support as quickly as we can. And you'll see we're on average around 3 days to provide that support both for the community and placements. So if there is any more information behind that concern you had, by all means put it forward to us and we can look a little bit deeper and see where that was from. That's a very quick whistle stop.
Thank you. No, it's a shame because capital reduction and self-funders is such an important area, and it's a very financial so I think we need to spend some more time at a later stage looking into how it's been brought up in scrutiny before now, and the deferment as well. We discussed this 6 months ago as well. So I think we need to move on to the work programme, spend some more time exploring that if you'd agree with that. Thank you very much. Are there any questions? We're really running out of time. Are we happy to leave it for that? Thank you. If I could just... So for all of those reports, they were very depth, very informative. And we talked about sort of the performance monitoring one, but at the last meeting we asked you to focus specifically on certain areas and the fostering along those lines and selective education. So I think we've had those reports in the detail which we want. So we really appreciate all the work you've done. Apologies, Mr. Rowe, for not getting to your education strategy, which I think is a fabulous report, lots of questions. And it's the first time I think Shropshire has got a provisional plan for education in our schools. So I'd like to highly commend that report. And I know we haven't had a chance to discuss it. So if you have any comments regarding it, if you'd like to let me know directly for it, but I would highly recommend that report goes further. It's with Cabinet or full council for further discussion then. This is such an important integral part to education in Shropshire. So thank you for that, Mr. Rowan. You spoke very well on that point as well. Thank you. Just one aspect of the report talks about working in liaison with sort of health education, looking at commissioning services. And one of the services is transport, which is significant cost getting children to AP providers and special needs. We talked about special needs as well. So I'd like council approval is to set the task and finish group to focus on the transportation of children to and from schools and to send provisions. Would you be willing to endorse that task force for me?
Proposal second, I absolutely agree with that.
Thank you very much, Thomas. I know you're part of the panel as well. Thank you. The second part is transportation is one thing. As we've had a briefing on SEN transport as well. And the next part is the actual cost of procurement from taxi companies to minibus companies we've breached. So we'd like to recommend that we ask audit and the governance committee to actually look at a best value practice, looking into the actual cost of the transport and the procurement processes for it, which came part of one of the briefings we had a little while ago. So it's a substantial cost to a local authority on the transport. Would that be acceptable for everyone? Thank you. And the final part is some committees have given authority to the chair and the vice chair to establish a task and finish group without coming to full committee. So should there be something else which we wished, or a member of the committee wishes to set task and finish group up, as long as we agree upon it, we can set that up with a committee sort of prior approval for it. Obviously, we'd let you know exactly what's happening immediately. Would that be acceptable for the committee to allow us to do that? I think it's open to all members. Am I right? Yes. So, for example, a task and finish group on transport, that invitation would go out to all members. So all members right across the council can actually join it. And with the other recommendation is, should, for example, you have an issue you would like to put the task and finish group, Mandy and myself then could agree it, and then we could actually initiate that as well. We're not going to get too excited and set lots up because we know the amount of work. But the one with the transport, we think is very glad about that, Shannon, aren't you? We're going to listen to them here. And if this meeting went on for another hour, I've plenty more to say. But can I just thank you all? I need to cover everything now. Oh, so the work programme.
Just that. So because of time, in terms of the work programme, I think there's been a lot of discussion this evening and some recommendations of what you'd like to see added. So those have been captured and will be included on and updated to the work programme that's been published. And I think my suggestion would be that then there's an opportunity for the committee to meet before the next session to be able to review that alongside what was already planned and to be able to prioritise because exactly as the chair has stated, there's a lot of areas that could be looked at, but it's about prioritising which would add the most value to the council and to the
I would appreciate that feedback from the cabinet members as well. Should there be any areas you'd like us to focus on in scrutiny? Having that forewarning, I think, would be really beneficial. What's happening in the future as well. Then we can add that to our work programmes as well. But I thank you all for your time and your contributions this evening. It's been a very productive meeting. And thank you to all the officers for all the hard work and the diligence you are doing for the people in Shropshire, which is fully appreciated by all of us. And we'll keep on going. Thank you. Have a safe journey home. It's quite dark out there now as well. Thank you all. Meeting's closed.
It's off.